The state of Tennessee continues to struggle with an opioid problem.
Last year, the state saw its overdose deaths rise while across the nation, numbers dropped.
In our Road to Recovery series, News 5's Preston Ayers explains how one new state program is finding success in helping addicts in Northeast Tennessee.
1,837. That's how many Tennesseans died last year from drugs, according to the CDC. 89 more deaths are believed to be drug-related, but are not confirmed.
This drug epidemic is taking people's lives.
In 2018, then Governor Bill Haslam introduced Tennessee Together, a legislative package targeting the state's drug problem. The Recovery Navigator program is one part of Haslam's plan. It started with the hiring of 7 former addicts who are now in long-term recovery. Their job is to help walk alongside addicts as they seek recovery. Polly Jessen and Monica Tucker are 2 of those 7.
I'm really excited to be one of the first navigators in the state.
These women both struggled with addiction for many years. Monica Tucker's addiction started as a child after being sexually abused.
Percocet to Roxy's, and then it went to heroin, then it went to methamphetamine, and then I basically just used polysubstance, everything. Anything and everything I could get my hands on.
She was addicted for 15 and a half years.
I have a little bit over 5 years clean right now, and it's just, it's amazing to see how much I've grown.
Now as navigators, they're part of the Frontier Health Crisis Response Team, meeting with addicts seeking help, telling them their own stories and offering support to get clean.
I'm just like them. They can identify with me. They don't feel like they're being judged, and they see that I understand exactly where they're at.
Here's how it works. The navigators first evaluate the person that's seeking help, talk about the options. 72 hours later, they check in again, and then follow up 30 days after that to see if the person is receiving the services they need. Most of the time, they are willing and accepting of treatment. However, we always get some people who are just not ready yet, and that's okay. We have to meet them where they're at. The numbers are astounding. In roughly the first year, navigators statewide met with 620 people. 431 of those were right here in the Tri-Cities.
I know it's working. I know it's making an impact. I know just from my caseload alone, I have dozens of people that I still keep in contact with that are still clean and sober.
The program expanded this year thanks to a federal grant. There are now 19 navigators working in 32 counties. Frontier Health began offering navigators in Hancock and Johnson counties last month. And while their stories are different, their message to the addicts is the same.
It's possible. You can do this. If I can do this, anybody can do this.
In Johnson City, Preston Ayers, News 5 WCYB.